Mr. Speaker, the last time we were in chambers, the Minister of Mental Health and Addiction made news because he claimed he saw people collapse and die while touring a supervised consumption site. I want to be very clear. Since the first SCS opened in Canada in 2003, Health Canada has reported 0 fatal overdoses. Will the minister apologize for misleading Albertans about what happened at the supervised consumption site? And will he reverse his decision to close the sites in Calgary and Lethbridge at the end of June?
The Honourable Minister of Mental Health and Addictions.
Well, thank you, Mr. Speaker. And as you point out regularly, we get 35 seconds to answer questions here, so I'm glad for the opportunity to clarify my comments. Drug consumption sites keep people trapped in addiction. When seeing people inject drugs in these sites, I was struck by the hopelessness of the situation. As we've seen in BC, NDP policies keep people trapped in addiction, and they end up dying. Addiction is a treatable illness. People caught in the cycle of addiction need help and treatment, and the Alberta Recovery Model is about helping people get the treatment they need. Unlike some of the members opposite.
And your 35 seconds are up, Minister. A point of order was noted at 2:16. Honourable member.
Given that the minister last week made a weak attempt at correcting the record by saying people merely appeared to die, and given that if...
Honourable member, you definitely don't get to bark while you're leaving the room, or any time that you're not recognized. Start your 35 seconds over again. You get a fresh start.
Given that the minister last week made a weak attempt to correct the record by saying people merely appeared to die, and given that if that were true, he would have also seen supervised consumption site staff immediately respond with emergency medical interventions to reduce the overdose and save that client's life. Can the minister tell us what he actually saw on his site tour? Why won't he recognize the life-saving efforts of frontline healthcare workers at the few remaining supervised consumption sites we have left?
Minister.
Well, thank you, Mr. Speaker. And as we know, these drug consumption sites, they were designed as a temporary crisis response, Mr. Speaker, and these sites do not break the cycle of addiction. They actually prolong it. They were not intended to be permanent. Since then, our system has evolved, and it treats addiction. Real change comes from recovery-oriented care and treatment that helps people reclaim their lives.
Order! I made us listen to the question, which we should anyways. Now I'm going to make us listen to the answer, which we should anyways. Go ahead.
Well, thank you, Mr. Speaker. A real change comes from recovery-oriented care and treatment that helps people reclaim their lives, rebuild relationships, and restore wellness. Albertans struggling with addiction deserve the opportunity to seek treatment and live a healthier and more hopeful life. And
the honourable member. Order. You know how it works. One person gets recognized, we listen to them. Let's try that.
Given that according to the ministry's own substance use surveillance data, in the last full calendar year, 55% of opioid-related deaths were in a private residence, 6% in a facility, 30% were in public, and 6% were in a hotel. And given that, in case you missed it, 0% were in a supervised consumption site. Will the minister remind us again why the one place where people are not dying is the place he's choosing to shut down?
We heard the question. Now let's hear the answer from the minister.
Well, thank you, Mr. Speaker. Our government has made major investments in expanding our addiction treatment capacity. We have expanded the number of addiction treatment beds, including detox treatment and recovery, by 55% since 2019. Mr. Speaker, right now we're building 11 recovery communities which will add more than 700 new beds to support more than 2,000 Albertans a year with life-saving recovery. Mr. Speaker, this is all available at no cost to the individual or their family. We also offer immediate same-day access to evidence-based treatment, medication through the virtual opioid dependency program, and our government is committed to supporting those facing addiction.